Hello and welcome. My name is Chris Hebel, and I'm the Chief Marketing Officer for GE's Global Molecular Imaging business. We wanted to spend a couple of minutes with you today talking about our vision for molecular imaging, how that is envisioned with regards to the overall molecular medicine business as a whole, and talk about the incredible number of facets that exist with molecular imaging. There are so many vendors, there are so many different processes that go into a molecular imaging protocol, to producing a report, to imaging the patient, to even scheduling that patient. And we know it's an incredibly complex procedure. We wanted to give you a little bit of a vision today about how we see that moving forward and affecting the overall molecular medicine business as a whole. So here today with me to talk about that is Jamie McCoy. He's our general manager for our global PET/CT business. And Jamie, I wanted to ask you about what your current observations are about molecular imaging and the industry at large.
Great, thanks, Chris. I think the base of any great vision really starts with your customers. And so for us, I'd say, over the past several years, attending many society events, customer events, trade shows across the globe, there's really, I'd say, a feeling of energy and excitement building around the potential for molecular imaging to really enable a new level of care. And that potential has always been there with functional imaging itself, but with all the new radiopharmaceuticals, the new therapies on the horizon, new technologies, artificial intelligence, a lot of things are really more than ever, in sight and right around the corner. Over this same period of time, we've within GE Healthcare spent a lot of time, talking to molecular imaging departments ourselves to really broaden our perspective on where some of those kind of critical challenges and opportunities lie. So we're fortunate to have a pharmaceutical diagnostics team within GE, and so they helped us look, further upstream into the discovery phase, understand where some of the challenges lie and the time and cost to bring new tracers to market. In the diagnosis stage, really looking at the time, the cost, the variability that exists within molecular imaging departments as key challenges that have really risen to the top. And then finally, in the treatment or space, there's new applications like theranostics that are emerging, new collaboration tools that can really help better connect care teams. So those are some of the things I think that we've heard over the last few years that really set up, a great next decade of enhanced patient care with molecular imaging.
Yeah. So Jamie, you mentioned a lot of things there. You mentioned everything that has to do with diagnosis to in beginning discovery of the radiopharmaceuticals and actually the isotopes that can be used to treat, all the way to then that treatment and the theranostics part. Which of those do you think is really going to give us the future of MI as we go forward here through the next years and even into the next decades?
Yeah, no, great question. I think the key enabler as we look at all these different pieces and parts, as you've said, is really one around care team connectivity. And so I'd say out of all the different pieces and parts in a molecular medicine pathway, it's the one about how we can best connect a molecular imaging, team, department, to really enable precise, personalized care. And the reason I say that is because there's so much data that flows across, a molecular imaging pathway today. There's so many different healthcare providers that have a critical role along the different steps of that pathway. And there's decisions that are made on, an individual personalized set of, treatment paths or diagnosis for each patient, along that pathway. And so I think it's going to become less and less about individual point solutions or individual features or technical specifications of devices. It's going to be less about, siloed data or discussions that maybe happen today. And it's really going to become more and more about how one connects all of these components together in an optimized, streamlined way from discovery through diagnosis through treatment.
Yeah, Jamie. So I hear you saying it's going to be a very holistic approach to how not only the patient is managed, but all of those processes are being managed. Would you tie that to any particular care pathway, or do you think there's like say a care pathway like prostate cancer that that concept would be particularly exhibited? What are your thoughts on that?
Yeah, I think actually prostate cancer is a great example. It's a particular care pathway that has a number of these developments that are happening, as we speak. And so I think for sure there still will be individual kind of product innovations along the prostate care pathway. There's new tracers that are emerging. We see a future in our cyclotron business where you can produce gallium-68 at 1/10 the cost of today's generator solutions with a solid state target. And there's a number of digital solutions both on the PET CT, the SPECT CT side, from both a hardware as well as a software perspective, that are really going to be great breakthrough technologies. But again, it's about how you connect that entire pathway to deliver really precise, personalized care. And so I think when you think about the molecular imaging pathway for prostate cancer in particular, you can think about the workflow and dosimetry solutions that really can link the production of tracers all the way through the optimal patient doses that are prepared. You can think about productivity solutions that can really optimize the flow of patients and information across a molecular imaging department or a theranostics pathway for a patient. You can even think about artificial intelligence and deep learning solutions that perhaps could be created and better predict which patients actually will respond best to a particular treatment. And then there's collaborative software that can be put together to really help bring all the data and information that care team needs at their fingertips. And again, really all in the light of trying to make the best decision for that patient. And so it's this connectivity that I think is really going to help the prostate care cancer pathway, as well as many more in the field of molecular imaging.
Well, thanks, Jamie. You've given us a tremendous insight into what GE Healthcare believes is the vision of molecular imaging, focusing all the way from that initial discovery of the tracers that will be used for imaging, for treatment, to the tools going into the diagnosis, to the radiotherapy and other things that are going to be used for treatment, and then the really comprehensive way that GE Healthcare wants to connect all of those together, all the people, all the processes, all the data. We're just generating terabytes and terabytes of data, and I hear you on that 100%. So thanks so much for sharing your vision with us today. Any other closing thoughts from you?
Yeah, just thanks for the opportunity here, Chris. It's really wonderful to be part of such an amazing industry with so many great customers and partnerships. And I think the future is fantastic for the next level of patient care.
Yeah, very well said. Thanks, Jamie.